So good evening, guys. Next class is nursing management with patient with endocrine disorder. So introduction: nervous system or the interconnected network of the glands. It's a endocrine system called. So it's a control the body system. So endocrine distress is the consequence of hyperfunction to each endocrine glands. So glands of the endocrine means hyper, pituitary, thyroid, and adrenalis. So everything it will come parathyroid and all, it will thymus and all. It's a endocrine. So function and regulation of the hormones. So this is secreted by the endocrine glands. It's called hormone. So endocrine glands are composed for the secretory cells arranged in a mini cluster. It's a acini. The glands and duct cells with a rich blood supply. So the hormone the produce enter the blood system rapidly. Then hormone concentration of the bloodstream is maintained relatively and constant level. So when the hormone concentration increase, the production of the hormone also inhibited to the worse. So it's a negative feedback. So classification of the hormone is steroid hormone, it's a protein hormone, then amino hormones, so epinephrine, the fatty acid means retinoid. Okay, so this is under hormones. So health history of clinical manifestation means if a patient wide signs and symptoms change the energy level or fatigue, tolerance of heat and cold, as well as recent change in weight, then changes in the sexual function and secondary sex characterize, then change the mood, memory, ability, concentrated, alerted, sleep patterns. So physical assessment change the skin structure of the both hyperfunction and hyperfunction. So eye changes is the exophthalmus will be there. Then changes of the physical appearance, facial face in the hair in woman, moon face, buffalo hump, thinning of the skin, obesity of the trunk. So extremities, then increase the size of feet and hands, edema. So vital signs elevated the PP occurred for hyperfunction, hyperfunction of the adrenal cortex, then tumor of the adrenal medulla, then decreased blood pressure occur to hypofunction of the adrenal cortex. So hypofunction of the pituitary gland means hypopituitarism. So it is a decrease the pituitary gland itself. This is called hypothalamus. The what are the complication? The complication of radiation therapy to head and neck area. Then total destruction of the pituitary gland by trauma, then tumor, then vascular lesions. So the result may be weight loss, atrophy, all the glands to the organ, the hair loss, impotence, amenorrhea, and hypometabolism will be there. So over secretion. So it's a hyper secretion. So this is for ACTH growth hormone. Okay. Then acromegaly, gigantism, then dwarfism, then panhypopituitarism, then hypopituitarism may calls for anterior loop of pituitary gland and postpartum pituitary necrosis. Symptoms they will ask. Okay, symptoms means it's a postpartum pituitary necrosis. Okay, then posterior pituitary, the most common disorder related to posterior lobe is a diabetes insipidus. So specific disorder of the pituitary gland means pituitary tumors. Pituitary tumor usually it's a present in overgrowth of eosinophilic and basophilic and chromophilic cells. Okay, so giganotus and acromegaly means gigantism is a overgrowth of a long bone developed in a children before the age when the bone is close. It's suffering giant may be 9 feet tall. Okay, acromegaly is the adult develop the after close the emphasis, that is long bones. It's increase the bone thickness. So hypertrophy of the soft tissue will be there. So mainly the etiology is the GH secreting of the anterior and pituitary gland. Okay, this is the gigantism. So you can see. Then acromegaly. This is the acromegaly. You can see forehead and small. Then broad arms with a spread like fingers. Okay. Then here diabetes mellitus, goiter, Cushing's disease, change the libidos and menstrual disorder and it will come. So what is the medical management? It's a radiation pituitary gland destroy the tumor, usually performed to the radiation implant. It's a transplantable approaches. So pharmacological management, sorafenib, can reduce the level of growth hormone and decrease the tumor size. So that age can be used for level of growth hormone. So high after surgery for until radiation occur. So surgical management is gigantism acromegaly is a hypopiocectomy, then partial complete removal of pituitary gland. Then they need corticosteroid replacement may be permanent. So nursing interventions, knowledge deficiency of the ruler for the surgery, then high risk injury of the ruler post-operative surgery, then knowledge deficiency of ruler of self administration of the pituitary replacement hormones. Then next hypopituitarism. So hypopituitarism means deficiency of the more hormone produced for anterior lobe of pituitary. Then when both anterior and pituitary fail means the secretory hormone it's a panhypopituitarism. It's called Simant disease. Okay. So diagnosis assessment ACTH. Okay. Then it's a secondary adrenal insufficiency. ACTH because gonadotrophic thyroid hormone deficiency, then cortical levels for both primary and secondary, then thyroid hormone, then hypothyroidism, then PSH and LSS sexual reproductive disorder. So medical means remove as possible cavity of tumor, then permanent replacement of hormones to secrete the target glands. Then pharmacology is a HGS means hormone high gigantism sufficiently growth hormone deficiency. So corticosteroid correction will be there, thyroid hormone treatment, then sex hormone will be correct to the hypogonadisms. Then nursing management. So posterior loop of the neuro hypophysial disorder. So that time what will be ADH diabetes insipidus will be there. So excessive ADH causes syndrome is inappropriate ADH secretions. So what will do diabetes insipidus is what is the first type? It's a ADH resulting in the physiologic imbalance of the water, that is called the diabetes insipidus. Physiologic imbalance of the water. Then incident diabetes insipidus is a rare disorder. So clinical manifestation two major. So polyuria, polydipsia. Then diagnosis instruments water deprivation test. So patient instruct the client not to drink water to concentrate the urine. So that is maybe positive for diabetes that is remain dilute. Okay, medical management administer benzothiazide diuretics and injection of ADH vasopressin we can give, and synthetic of and the polypeptide demerins acetate instilled through the nose in the morning at bedtime. Okay. Then nursing and maintain the adequate hydration, then electrolyte balance, then preventing the complication, assess the effectiveness of the medication. The client also must learn self-administrations injection to nasal spray. Then a client undergoes hypophysiectomy nursing care of the same. So here SIADH means syndrome of inappropriate antidiuretic hormone. So syndrome of inappropriate antidiuretic hormone disorder associated with the excessive amount of antidiuretic hormone resulting of the water imbalance. So what is the normal clinical investigation? CNS dysfunction, it's characterized by the level of consciousness, seizure, coma. Then serum sodium falls to 120. Okay, normal sodium is the 130 to 150. Okay, then hyponatremia. Hyponatremia can result diminished gastrointestinal function. The problem is complicated with the fluid restrictions. So diagnostics assessment is the presence of hyponatremia with normal expected plasma volume. So medical management, fluid restriction, very careful replacement of sodium chloride, administration of the diuretics and dimoclomine, then correction of causes if possible. Nursing anatomy, fluid status and electrolytes should be closely monitored. Cardiovascular status also should be assessed regularly and alteration of the immediately noted. The client's weight should be recorded. If any gain for 2 pounds should be reported to the physician. The client neurological status should be monitored. The alteration related to the hyponatremia immediately diagnosed to the non-treatment can be treated. The nursing, so injury high risk rule out of the danger of the cerebral edema and water intoxication, then CNS dysfunction and fluid excessive rule out for excessive secretion of the adrenodiuretic hormone for secondaries. Okay, so this is a normal endocrine disorder and